Hi there, I'm Dr. Jim with Vintage Heights Veterinary Hospital, and today we're going to talk about dog eyes.
Dr. Jim, what are some of the signs that my dog might have an eye infection or disease?
Well, if your dog is squinting, or if there's a lot of drainage from the inside corners of the eye, or if the eyes look red or cloudy, those are all indications that something's going on. And sometimes your dogs will frankly just rub against things or scratch them with their paws. And again, they're trying to tell you, hey, something's irritating my eyes and I need some help.
What are some of the causes for eye infections and diseases in dogs?
Well, sometimes it's just trauma because, dogs like to investigate. They like to stick their heads into things that they shouldn't, chasing a rabbit. Other times it can be the typical things like viruses or bacteria or occasionally even fungi. Sometimes we'll see fungal infections of the eye. So those are some common things that we run into, but probably the most common thing is dogs putting their head somewhere where they should not, and they get what's called a corneal ulcer.
What are the most common eye care issues you address in the clinic?
Well, the number one thing for dogs, as I kind of alluded to, is the corneal ulcer. That means where they basically scrape the cornea. And if you've ever had that yourself, it does feel like someone's putting a big finger in your eye. It's very uncomfortable. It makes you squint, makes your eye water. They can also have issues like with cataracts, conjunctivitis. Sometimes they'll have issues with a prolapsed tear gland. It's called a cherry eye. It occurs in the corner of the eye and it looks like a little cherry tomato sticking up. Sometimes they'll have an issue called entropion, where the eyelids have too much skin and they roll in, or we can have the opposite of that called ectropion, where there's actually too much skin and sagging down, and so we have to tighten those up. And the entropion and ectropion procedures, those are corrected by surgery.
What eye problems in dogs are considered emergencies and need immediate medical attention?
Obvious squinting, if the cornea, the clear part of the eye looks cloudy and there's a lot of discharge, a lot of squinting associated with that. And sometimes people they will look in and they can tell that the eye is kind of melting, almost like an ice cream cone. That's a very serious issue, and so we need to see that dog right away.
Are certain dog breeds at a higher risk for eye issues?
It varies. Generally, smaller dog breeds tend to have more issues with the cherry eye. Remember that prolapsed tear gland that occurs in the corner of the eye. Certain breeds like Shar-Peis have more issues with what we call entropion, where there's too much skin and it rolls in. St. Bernards can have issues with entropion. They can also have issues with what we call ectropion, again, where it's too baggy. And again, those are things that we can correct surgically. So hunting dogs, obviously, because they're putting their heads in places going after waterfowl or whatever they're hunting, again, they're more prone to getting corneal ulcers as well.
Is there a dog eyesight test that can be done to assess my dog's vision?
Well, it's not like we can ask them to read the E on the chart. So basically we can shine a light in the eyes and see if the optic nerve responds like it's supposed to as the pupil constrict. We can look at the back of the retina and see the vessels and make sure it looks okay. And then of course at home as an owner, you're going to notice, okay, can my dog track things? Like if you throw a frisbee or if you throw a ball or if you throw a bone on the floor, can we find it? Those are all things that are important to us to know. But there's not something that's direct like us, hey, can you read what letter or what line can you read on that chart? But we kind of do it indirectly.
Will my dog need to see a specialist for an eye injury?
It depends on what's going on. Sometimes yes. If it's a severe, what we call melting corneal ulcer, yes. But like typical corneal ulcers, we generally can handle in clinic. The entropion, ectropion, again, that's a surgery that we do. Same thing with like the cherry eye. But for example, if your dog has cataracts and needs cataract surgery, we're going to refer you to a veterinary ophthalmologist who has the proper training and equipment to do that properly.
What can I do to care for my dog's eyes at home?
You can buy wipes, that are kind of like the little wipes that you would use for toddlers, and you can use those to kind of clean the eyes. They do have eye irrigation solutions that you can buy over the counter. Again, and sometimes some of our hunting dog owners will carry them with them in case the dog does get something in the eye. At least they can flush it out in the field. So again, it's just basic care. It's kind of like for you, if your eye is draining, you need something kind of cool and moist to clean it off. And again, so there are some things that you can buy over the counter that can be helpful until you can get in.
Is there anything that I can use to protect my dog's eyes?
As a matter of fact, there are what they call goggles. They kind of look like the swim goggles for a dog. We do use them for our therapy laser to protect the dog's eyes when we treat with that. But they also make them for hunting, and you can buy them at various hunting stores like Dick's Sporting Goods or Cabela's and or Bass Pro Shop. And so I do have some clients that when their dogs get in the brush, that's what they wear. It's kind of like a protective layer over the front part of the eye, and so it can be very useful. Again, the dog has to be able to tolerate it.
How can I clean my dog's eyes at home?
Again, as I alluded to, there are wipes that you can specifically buy, kind of like, the cleaning towelettes. Obviously, you can buy some contact lens irrigation solution or eye irrigation solution and squirt that in. Again, these are kind of stopgap measures to get you through until you can get in and have things evaluated. So I hope you find the information useful, and if you have more questions, give us a holler. Our number is 402-489-0501. Have a good day.